Did you know that suicide is the second leading cause of death among student athletes? The mental health of over 500,000 people is affected. Let's talk about it. In the NCAA or adjacent leagues, there is over 526,000 student athletes, 44% of which are female. The majority of student athletes are white at 62%, followed by black at 16%, Hispanic and Latino at 7%, and international students account for about 5%. The competition involves team sports, individual sports, and newly incorporated esports. Before I dive into my capstone project about the factors which affect student athletes' mental health, I would like to tell you a little bit about myself. Over the past 6 years, I attended three different universities and competed in basketball at two of them. Firstly, at University of Minnesota, basketball was everything for me. I struggled a little bit in school and even had to drop some classes in my freshman year. And honestly, I had no social life. I ended up getting injured my freshman year, gained a lot of weight, and my mental health declined drastically. But it wasn't until my sophomore year when I started to attend therapy. And eventually got diagnosed with depression and anxiety and put on various kinds of medications, none of which worked. After 2.5 years of not getting along with my position coach and honestly not getting along with most of my teammates, I decided to transfer mid the COVID pandemic. I didn't know where I was gonna go. I couldn't visit the campus. So just through phone and all of that, I decided to transfer to Florida International University. Here, due to COVID, we couldn't leave campus and had to quarantine a couple of times. So I spent my first half a year stuck inside, which definitely did not add onto my mental health. In October 2021, I got diagnosed with bipolar 2 disorder and I needed to get used to new medications. I was struggling in practice, getting used to the meds and my emotions being all over the place. I kept getting kicked out of practices. And eventually, I got kicked off the team for, and I quote my head coach, not being 100% mentally ready for the season. This sent me spiraling, and for a whole year, I was trying to pick myself up and build my confidence. In January 2022, I broke my foot, so my physical activity was even more restricted. I focused on finishing my bachelor studies, got my degree, and then decided to transfer to the University of Evansville. Here, I finally got to play. Although the team environment was low-key toxic, I made it through with the help of my American and Czech families. However, this last year was especially tough. I was on the wrong medication during summer, ended up entering the worst depressive episode I've ever been in. I ended up breaking up with someone who was making my life better and who was genuinely making me happy. During the same time, I injured my back and was dealing with that for the rest of the season. I was in and out of practice, and honestly, even on and off the team. I missed 10 games. I played the last two games of the season only because the team did not have enough players to compete. Somehow I got through the basketball just to be overwhelmed with school once that ended. And on top of that, about 2 weeks ago, my grandma died. And I've been struggling to finish any assignment because I've been thinking about how I couldn't be there for her and how I haven't seen her in 3 years and how I'll just never see her again? Um, sorry. With that being said, over these 6 years, I have thought about ending my life more times than I can even count. Yet I am here to tell you my story. I have been through hell and back, and now it's time to move on into the new chapter of life after college, which is a challenge on its own. I am not telling you this to get any sympathy or anything like that. I just want you to remember, if nothing else, please remember that student athletes are still only human beings and we have so much more going on than simply the sport we're participating in or simply the school. There's also our personal life, and you never know what anybody is going through. And with that being said, I would like to move on to my capstone project. The rationale and purpose of my capstone project was to summarize key findings in research regarding three main themes: These themes were the impact of COVID-19 on mental health, the influence of performance centric model in athletics, and the significance of coach athlete relationships. The methods were extensive search on Google Scholar and finding current and relevant articles. Researchers have been looking into how the pandemic affected student athletes. COVID 19 brought a lot of changes to sports, like canceled seasons and strict rules when returning back to competitions. Um, Athletes had to deal with quarantine, virtual communication, and new safety measures when they returned to practice. A study by Grabenspeger et al. Found that despite worries about COVID 19, teammate support was really important for athletes' mental well being. It helped them keep their sense of athletic identity and cope with depression, as loss of athletic identity was associated with lower psychological and social well being and more depressive symptoms. So, having a supportive team environment is crucial for athletes during tough times like these. The next factor in mental health of student athletes is the performance centric model or the performance at all costs approach, which has negative effects of athletes' well being. A study by Whitehead and Senegal in 2019 pointed out three big problems with this mindset. First off, there is a risk to health and well being, as student athletes will push themselves too hard and ignore their body's signals because that's what they're learned to do. That's what everybody tells them to do, to push through the pain, to always give 110%. Um, the next problem is that it leads to hindered psychosocial development, where people base their self worth on athletic achievements, and after college, they struggle to find the right self perception of themselves. Um, it can mess with athletes' personal growth and the sense of self, especially when they're no longer at their peak. The last problem that Whitehead and Senegal found was the lack of balance in life, which means either balance in life, balancing sports, academics, and social life, or balance in medicine, where excessive exercise is counterbalanced by excessive medical interventions. The authors suggested a few things to help fix this. One, colleges should care more about athletes' well-being, not just winning games. Two, they should listen to what athletes actually need instead of just focusing on the money and fame. Three, sports should be about more than just getting better at your game. Athletes should also enjoy what they're doing and grow as people. And finally, coaches and departments should see athletes as whole people with lives outside of sports. Um, the last factor I decided to talk about is the coach athlete relationship. And the quality of coach athlete relationships significantly impacts aspects of mental health, such as psychological quality of life and depression. Poor quality with coaches contributes to stress and negatively affects mental health. Uh, a study by Powers in 2020 was looking into this um, as the first study to focus on mental health aspects of the coach athlete relationship. Previous studies have talked about coach athlete and the performance um, but it is very important to know that the coach can make or break an athlete. And I can tell you from my personal experience that the coaches that I have been very close to, I have felt more confident in my performance and I felt more confident in talking to them about my problems. And the coaches who just didn't put in the effort to have that relationship with me were never able to actually coach me correctly or um, like my teammates didn't really get coaching from them because there was no relationship. Um, so basically, the suggestion is that coach training should focus not only on improving performance, but also on supporting athletes' mental health. Coaches should learn how to build better relationships with their team athletes to help them perform better and feel better mentally. So here are some of my recommendations for a better future. First, institutions should prioritize the development and implementation of comprehensive mental health service programs, specifically tailored to the needs of collegiate student athletes. These programs should include access to mental health resources, such as counselors and sports psychologists, who are trained in addressing the unique challenges faced by student athletes. Additionally, initiatives such as peer support groups and mental health education workshops can help foster a supportive environment and destigmatize discussions around mental health. Next, coaches and athletics departments should prioritize creating positive team environments characterized by open two-way communication, mutual respect, and support. Encouraging teammates to build strong relationships and provide social support to one another can help diminish the negative effects of stress and promote overall well-being. Team building activities and regular check ins with coaches can also strengthen the coach athlete relationship and contribute to a positive team culture. The next recommendation is for institutions to integrate mental health education into athletic programs to raise awareness about common mental health challenges, coping strategies, and available resources. This can include workshops, seminars, and online resources that provide student athletes with the knowledge and skills necessary to prioritize their mental well being. Coaches and staff should also receive training on how to recognize signs of mental distress and provide appropriate support and referrals. The fourth recommendation is to promote sport life balance. Athletic departments should prioritize promoting sport life balance among student athletes by encouraging them to engage in activities outside of their sport and athletics. This can include encouraging hobbies, socializing with friends and family, taking regular breaks to rest and recharge, and emphasizing the importance of self care and setting realistic expectations for performance can prevent burnout and promote overall well being. The fifth recommendation is to advocate for policy changes. Institutions should advocate for policy changes at the NCAA and conference levels to prioritize the mental health of student athletes. This can include advocating for increased access to mental health resources for student athletes, or advocating for increased access to mental health services, reducing stigma around mental health, and implementing guidelines for managing mental health crises. Additionally, institutions should prioritize the recruitment and retention of diverse mental health professionals who can provide culturally competent care to student athletes from diverse backgrounds. Lastly, we need to continue research, which is essential to further understand the mental health and needs and experiences of collegiate student athletes. Institutions should support ongoing research initiatives that explore the impact of factors such as race, gender, and sport type on mental health outcomes. This research can inform the development of evidence-based interventions and policies aimed at improving mental well-being of student athletes. In conclusion, there is an urgency for tailored interventions and support systems, a paradigm shift towards prioritizing holistic well-being over mere achievements, and it is important to create supportive relationships. By implementing these recommendations, institutions can foster environments that support the holistic development and success of student athletes both on and off the field. And lastly, please stop pretending like you care about student athletes and actually do something to help them out. Thank you.